what we're going to be discussing for the first part of this week are pathogens. Essentially, you guys will be getting into a field where you need to be equipped with the knowledge and also the instruments that's going to protect you from the dangers of working in a clinical setting. Don't be fooled by it being called a hospital or a clinic, because you will be exposed to things that you can't see. Microorganisms, pathogens. These are things that can cause disease and also death. So, pathogens, what exactly are they? They're basically microorganisms. We are composed at a cellular level of many microorganisms. Some good, some bad. The bad microorganisms that we're going to be talking about here are called pathogens, and they are the ones that can cause sickness, infections, and also death. We'll be talking about the different categories of these pathogens. We'll talk about bacteria, protozoa, fungus, and also viruses. Also parasites are going to be part of that. Let's talk about the cycle of infection. Talked about pathogens. Pathogens are the ones that can cause illness and infections. So essentially, you need originally first a host. A host is what provides the proper environment for these pathogens to grow, multiply, divide, and then spread their infection to other hosts by way of a reservoir where they're going to grow and thrive. A way to exit the host. Once they exit the host, how are they going to be transmitted into a new host? And then the cycle starts all over again. Okay? So we will be spending a little bit more time on this in a few minutes. The concept of minimizing the amount of the spread of pathogens is known as medical asepsis. The key here, again, the definition is as free from pathogens as possible. Free. We're trying to eliminate as many pathogens as possible. What is the best way to eliminate some of these pathogens?
Sterilization.
Well, let's not talk about sterilization yet, okay? We'll get there, okay? But I heard it. What is it? Hand washing is the best way. We're talking about using soap and vigorously rubbing your hands. Okay? The misconception is using soap is what's going to kill the germs. Okay? That's just a small part of it. It's actually the friction that you cause that will remove and kill most of those germs. Now, when you read the bottle, let's just say dial. Okay? What does it say on the back? Is it getting rid of 100% of those germs? 99.9%. So you still have that 0.1 that exists. So to minimize some of these germs in a clinical setting, we're also going to change our linens. We're going to wipe down the countertop. We're going to wipe down the equipment, okay, and any instruments that we use. This is known as disinfection. But it's still 99.9%. This is medical asepsis, as free as possible. Now going back to what you were saying, Nick, okay, sterilization, on the other hand, you still have, with the germs, you still have the portion of it that can reproduce. It's the reproductive part of these germs that allows it to reproduce. That's the 0.1%. If you don't kill those germs, they can reproduce. So to eliminate the reproduction of these germs, you have to eliminate the spores. Have you heard of that term before, spores? Okay. Spores is going to be the functional part that causes these germs to replicate and multiply. When you get rid of those spores, they can no longer reproduce. Are you guys following me? It now becomes sterilization. This is 100% elimination of germs, because now you've killed their reproductive portion. That's sterilization. Okay? Medical asepsis is S-free. It's still 99.9%. You're not completely eliminating it. The methods that we use to prevent the spread of infection Number one is disinfection. Okay, we talked about that. 409, fantastic. Alcohol. Okay, wiping the counters, disinfection. Okay, using chemicals to remove some of these pathogens. Now, have you heard of the term antiseptic? What is the difference between an antiseptic and a disinfectant? Are they the same? They're the same. Yeah, they are the same, okay? But the terms apply to certain things. They're doing the same thing, but when you're talking about disinfection, we're talking about the use of chemicals to remove these pathogens from inanimate objects, like the countertop, the instruments that you use, okay? Your x-ray equipment. That's disinfection. Okay, so we're using chemicals on inanimate objects, non-living things, to remove the pathogens. Whereas an antiseptic is used on living things. Give me an example of an antiseptic. What's that?
Humans?
Yeah, on humans. So what do you say?
Bactine.
Bactine. Okay. Neosporin. Okay. Hydrogen peroxide. The most common things that we use household is mouthwash. That's an antiseptic. Okay. Proper dress. Okay. Making sure that you're wearing the proper attire to minimize the amount of infection. So we'll talk about that later. Gloves, gown, mask, so on and so forth. And also clean work area. Again, the key here is known as medical sepsis. We're trying to minimize as much as possible. Okay, your number one line of defense for protecting yourself from these pathogens is an intact skin. So your skin can't have any cuts. Your mucous membranes within your mouth, within the anal canal, your vaginal canal, the urethra. Okay, those are skin. And if they're intact, you're protecting yourself. If there's a break in that, now you're allowing the outside world to enter your inside world. And when that invasion occurs, this is how you get infections. This is how you get sick. And if it's lethal, you can die. Follow? So your skin is going to be the your number one line of defense. So if you are working in this type of environment, you want to make sure that all cuts and openings are covered. Now we said the number one way to minimize the amount of the spread of infection is by what? Washing your hands. Here's the catch. If you're constantly washing your hands, what's going to happen to your skin?
They get dry.
They become dry and brittle, and you can have cuts on your skin. So you also got to be mindful that as you're washing your hands, you've also got to
Lotion up.
okay, moisturize it. Okay, hand hygiene is important in your safety. Okay, it sounds like very minuscule, and it sounds like just a small thing to do, but to consciously remember to wash your hands and then wash it properly, and then to moisturize it, it can become very tedious. Okay. All right, so we're constantly washing our hands. By the end of the day, my hands are very, very dry, very brittle, but in between, I do remember to moisturize them. I like coconut. Okay, it also smells nice. Okay, so defense against disease. First line of defense is going to be an intact skin. Number two, your second line defense is going to be the inflammatory process of the site of infection. Okay. Your blood is circulating throughout your body. You've got your red blood cells, which carry oxygen, okay, and nutrients to your vital tissues and organs. You guys remember that?
Mm-hmm.
Okay. Within your blood supply, you also have white blood cells. I keep saying what? White blood cells, it's what's caused the inflammatory process and fights the infection. So this is what we're talking about here, is the inflammatory process. Anytime you have injury, there's going to be a rush of blood supply to that site of injury. Not only carrying red blood cells, but also white blood cells, which fights the infection. Okay? First thing that happens when you go to a hospital and you're very, very sick, one of the things that they can do is take labs or blood draw. When they do a blood draw, they're trying to see your white blood count. Your white blood count. And if there's an increase in your white blood count,
Something's wrong.
that means there's something wrong. There's an infection going on. Okay, so that's the first thing that they do. Your third line of defense is going to be your immune system, your immunity. Okay, your body are full of antigens. When your body is invaded with antibodies, foreign material, the antigens kick in to eliminate those foreign bodies. Okay? This is your immune system. When does the immune system, when did you start developing that?
As soon as you're born.
When you're born. It happens when, and this is what happens with mothers, you have the doctors highly recommending that you breastfeed your kid because in the mother's milk there's plenty of antibodies. Plenty of antibodies. Okay? That's the beginning of the building of your immunity. And then as you grow up, how many of you guys have kids? Okay? If you have kids, when do they start getting sick? Preschool, okay? And they're going to constantly get sick anywhere from 6 to a dozen times in that first year, okay? Why? Because they're exposed to those types of infections, and what's happening here is they are building their immunity, okay? Now, some crazy thing that happened a few years ago, and it was accepted in some society in that there was a mom who had a child that had chickenpox. And she would purposely have the child suck on a lollipop, and these lollipops will be distributed throughout the area. And those lollipops would be given to the kid, so they would also get purposely have the chickenpox to build their kid's immunity. You guys hear about that?
No.
My mom chickenpox.
That's pretty crazy.
What was it?
Chickenpox parties. They'd have a
Yeah, chickenpox parties, yeah. So you purposely expose your kids to these elements.
Get it over with.
And just get it over it. Right. Right? So instead of waiting, it happens immediately, okay? So
Isn't
your
it
immune
chickenpox though
system-
that can become shingles later on in life?
Exactly, so we'll talk about later. So yeah, it starts off chickenpox, you'll have that in your system, and then as you get older, these can turn into scabies.
Ugh, like painful,
Yeah.
I hear.
Yeah, they are painful. All right, so you build your immune system as you get older, and each time they're exposed to an infection, you are building your immunity, okay? So that's your third line of defense. All right, limiting the spread of infections. There are several agencies responsible for monitoring patient and employee safety. These include the California State Department of Health. This includes OSHA, which stands for the Occupational Safety and Health Administration. You also have JACO, and have you heard of this, the CDC, the Center for Disease Control and Prevention? You usually don't hear about them until there is an outbreak or epidemic or some kind of disease going out there, okay? You started hearing about them when Ebola was an outbreak, right? Then you heard about them again when measles. There was a measles outbreak in Disneyland. You guys remember that? Okay. Now you're hearing about them again because what's going on in the world? What's the latest one? The Zika.
That the one in Brazil or no?
That's the one in Brazil, but it's in here now.
Wow.
It's here in the U.S. Okay, the Zika virus. And all it is just a virus. It gets you sick. It's just like a cold. But the problem with that is that as an adult, it doesn't affect you. It's just a normal fever process that you go through. However, if you're pregnant, there's something in the DNA of that virus that causes birth defects on children, unborn kids. But as an adult, it doesn't affect you. You just get sick. But it causes birth defects on unborn kids. So they will usually come around when there's an epidemic. They want to know where it's coming from. They're going to study it and they're going to develop ways on how to prevent the spread of the infection. Okay, let's talk about nosocomial infections. Nosocomial infections are basically hospital or medical treatment types of infections. They're acquired at the hospital or through some process of a medical procedure. Okay? So you come into the hospital, you come in for one ailment. Is it possible that you may acquire another ailment while you're there? Right? The hospital is full of sick people. That's what we deal with, right? So you come in for one thing, you can end up with another type of infection while you're there. These are nosocomial infections. And to minimize that, we are constantly disinfecting our environment. Okay? We also want to make sure that we're not taking anything home with us and giving it to our family members. Okay? All right, so nosocomial infections occur during hospitalizations or medical procedures. They are extremely dangerous and they can also cause bed sores, illnesses, and even death. We'll spend more time on that on the next set of slides. Okay, I'm going to skip this for now. Okay, therapeutic regimen. Therapeutic regimen is also a cause for certain types of diseases that you find in the hospital, but also outside in your regular environment. When you get sick, what is the first thing that you do? Okay, yeah, you go to the doctor and say, give me some medication. Okay, give me some antibiotics. The problem with that is that every time you get sick and you go to the doctor to get antibiotics, you may also be causing yourself some harm, right? Eventually what will happen is, yes, you may get rid of some of the illness, but some of it may remain, and it's all the part that remains are usually the stronger ones. And they'll remain dormant until you get sick again. So each time you take an antibiotic, you're killing the weaker ones, but the strong ones may survive. And eventually what happens is you keep taking stronger and stronger antibiotics, where now what you have is a super pathogen. And then no antibiotic is going to help you. You guys follow me so far? So we're getting a lot of different types of antibiotic-related illnesses in the environment. Have you guys ever heard of MRSA or MRSA? Okay, it's a staph infection. You can get a staph infection, and even methicillin, okay, which stands for MRSA, you have methicillin-resistant Staphylococcus aureus. Your body becomes resistant to that methicillin. It's a very strong antibiotic. It's not going to help you. Another one that's also strong is anyone who has VRE. V is vancomycin, which is even more stronger than methicillin. And if your body's resistant to vancomycin, you better hope your immunity kicks in, because otherwise you're going to be sick for a very long time. Okay, that's VRE. Now here's the opposite extreme. If you were given antibiotics, and usually the regimen is between 5 to 7 days, right? Mm-hmm. So you take your antibiotic once or twice a day for the next, let's say, 5 days. However, on the third day you feel good. What do people have a tendency to do?
Stop.
They stop taking it. All you've done is you've killed the small pathogens. You still have the strong ones lingering in your body. Okay? If you don't go through the entire antibiotic regimen, the ones that survive become stronger, and they multiply, and you can even get more sick. Okay, so those are the two extremes. We're seeing a lot more of these type of antibiotic-related illnesses in our environment. We'll talk about appliances, things as special catheters, okay? Surgical procedures. Remember here, what did I say is the number one line of defense?
Our skin.
It's going to be your skin. When you're inserting special catheters, you got to break the skin. A PICC line is an overglorified IV line. We'll talk about that later. Urinary catheters. You well know what urinary catheters are?
Oof.
You basically have a tube sticking out of your urethra. Okay? And as long as these tubes stay within your body, you are creating the path from the outside world to the inside world. As long as that maintains, there's a great chance of you getting an infection. Surgical procedures. Most surgical procedures require a cut of the skin or the tissue. Now we've broken down our barrier. There could be an increased chance of that individual getting an infection. Okay? And we'll also talk about wound care. So how do we protect ourselves? So OSHA developed a guideline that says that we need to treat all individuals as if they are carriers of some disease. Okay, I don't care who you are, I don't care what your background is, I'm going to treat you as if you've got something infectious. Okay, so I'm going to protect myself with the minimum requirement that anytime you enter a patient's room, what are you going to put on?
Gloves.
Gloves. This is known as standard precautions. It's a standard. It's what everybody follows. So when you enter the room, the minimum requirement are gloves. Okay? And depending on what type of infection they have, you may have to wear additional what's known as PPE. Personal protective equipment, PPE. Personal protective equipment. Gloves fall under that category. Masks fall under that category. Gown, splash goggles. Those are personal protective equipment. So depending on what type of infection that you may have, my PPE may include goggles. It may include a mask. But it's all dependent on the type of infection that individual has. Okay? So they are implemented according to, again, the type of infection. Is it based on contact? If I touch you, is there a chance of me contracting that infection? Is it fluid? Fluid coming from the urethra, the intestine, your mouth, your eyes, your nose, your ears. A cut. Okay? Vapor. Someone who may be coughing and sneezing. This is known as Tier 1. It's broken up into two different tiers. The application of a PPE falls under the category of Tier 1. What is it that we need to wear to protect ourselves? That's Tier 1. Tier 2, jumping ahead of myself, let's talk about Tier 2 later. Okay, so universal precaution and standard precautions are the same thing. They mean the same thing, all right? What is the minimum requirement? Gloves. And how are you going to treat your patient?
As if they're infected.
As if they have an infection, plain and simple. Okay? Oh. Okay. She's actually one of our instructors. This is Miss Pack. Miss Pack, she just started this semester. Okay, so gloves. Okay? When you're coming in contact with some kind of contaminated object, okay? Could be counter, table, linens, a stethoscope, or even a drinking cup. Okay, you're gonna wear gloves. If you're gonna be coming in contact with an open wound, gloves. Okay, a mask. A mask would be worn to protect yourself from droplets. So if the infection or the pathogen is in my saliva, okay, coughing is going to spew it out in the environment. Sneezing is going to spew it out into the environment. Simple talking, conversation, can cause someone to get sick just through normal conversation. Okay, so you may wear a mask. Am I scaring you guys yet? Remember what they say. What doesn't kill you makes you what?
Stronger.
Makes you stronger. I'm very powerful. Nothing's gonna kill me. I've been exposed to many elements. Okay. Yeah, you actually become healthy, more healthier as you work in these environments. Okay. Gown. If you're going to come in close proximity to the infectious agent, that can be found in fecal material, on urine, any type of blood. Again, if you're in close proximity and you don't want to get your scrubs dirty or saturated, okay, you're going to wear a gown. Okay? Eye protection. If you're going to be exposed again to mist or vapors, or even if there is a tendency to surround yourself with a splashing type of environment. Okay? You're going to wear eye goggles. Now, wearing regular glasses is not going to protect you because look, you still have an opening here, here, and underneath. So we want goggles that wraps itself around the area to prevent any type of contaminants from seeping underneath or over on the sides. Okay? Eyeglasses are not enough. Okay. Tier 2, that was Tier 1. What are we going to wear? That is your PPE. PPE again stands for Personal Protective Equipment. Now for some of you guys who have had me, okay, you kind of already know that if I repeat things over and over and over again, what does that usually mean?
Write it down.
It's going to be on the test.
Remember it.
Okay? Yeah, so learn it, know it. All right, so if I spend a little bit more time on a certain topic or material, that means it's probably going to be on the examination. All right? Isolation protocols is going to be Tier 2. Tier 2 refers to how I'm going to isolate or remove the infected individual from the rest of the environment. During their hospital stay, they're going to be put in a special isolated room to protect the rest of the environment. Your doctors, your nurses, the visitors, okay? They will be placed in an isolated room. So that is Tier 2. And again, how they're isolated or separated from the rest of the environment depends on the type of infection that they have. Okay? Any questions so far? So again, it all depends on the type of infection that they have. We're going to spend a little bit more time on this in just a few minutes. Okay. So when you're working in an isolated room, you're working in a room, okay, let me back up here a little bit. A lot of our procedures may be done outside of the radiology department. If the person is too sick and they're hooked up to different medications, IV lines, heart monitors, things of that nature, and they're too sick to come down, we will perform the procedure inside the room. And if they're isolated, okay, now you have to be more cautious, right? Because now they have something that's very infectious. So you need to protect yourself. And you need to protect any instruments and equipment that you bring into the room. Because you don't want to bring it outside, do you? You want to maintain it within the isolation room. So if you happen to go into a room that is isolated, it's sometimes problematic if you're just going in there to do the procedure yourself. Because when you enter the room, you're wearing gloves, you may wear a gown, so on and so forth. But every time you touch the equipment, after you touch the patient, before you touch your equipment, what do you have to do?
Wash your hands.
You have to remove your equipment so you're not contaminating your instruments now. Right?
It's a double glove.
Right. And then, oh, I forgot to do something. I got to go back and move my patient again, reposition them, or readjust the instruments, like say an x-ray plate behind the patient's back. When I do that, I got to glove up again and put on the gown. And before I touch my instruments, I've got to de-gown and de-glove again. Are you guys following? So it's very tedious. So if you happen to go into a room that's isolated, bring another person with you. That way you have one dirty tech, okay,
Clean tech.
and you have a clean tech. The clean tech is the one that's going to remain around your equipment and control the equipment, and the dirty tech is going to be the one doing the dirty work, the contaminated work. It just makes it more easier to do. Okay?
Do you guys flip a coin to see who's clean and who's dirty?
Yeah, usually because of seniority. If you're a senior, you're going to end up being the clean tech. It's the newbies that we have them do the dirty work. Okay? Now, before you leave the room, you said it, before you leave the room, you got to wash your hands. Before you leave the room, you got to decontaminate your equipment, so you need to spray it down. All the contaminated PPE that you've worn needs to be discarded in the patient's room. It doesn't leave the patient's room. Okay? Any questions so far, guys?